Welcome, everyone. Welcome to the first time that the Oregon Pediatric Society has hosted an interactive public video chat with pediatricians. My name is Julie Schultz, and I am the Executive Director of OPS. We are a nonprofit that promotes the best health and development of infants, children, adolescents, and young adults, together with their families, communities, and healthcare providers. The pandemic has brought us into a time of uncertainty. It can feel frightening, stressful, and it can also bring out our kindness toward others and compassion. Please don't wait to get the care that you need for yourselves or your children. Pediatricians are here for you. Contact your doctor's office. I would like to let you know that this community conversation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Again, please contact your physician with specific questions that you might have regarding a medical condition. The American Academy of Pediatrics is the professional organization for pediatricians. They have updated information on COVID-19 and other parenting resources and articles by pediatricians on their website. That's healthychildren.org. Now, for those of you who are familiar with this audio and video conferencing tool, or if this is your first time using Zoom, we hope it is an enjoyable experience. During our time together, you'll be able to see and hear the pediatrician panelists, but we won't be able to see or hear you. However, if you have a question or a comment, you can click on the Q&A box that's at the bottom of your Zoom screen. Maybe if you don't see it sometimes, if you hover a mouse or whatever you're using, a finger, that will allow you to type in your questions or comments. Now I'd like to introduce each of today's webinar panelists. And I'd like to start with Dr. Sherry Alderman. Dr. Alderman is a developmental behavioral pediatrician, and she's the past president of the Oregon Infant Mental Health Association. Sherry, do you want to just say a little bit more about yourself?
Sure. Yeah, it's a pleasure to be here today. I know that we are all together and holding each other through these stressful times. And as Julie rightfully said, want to be practicing self-compassion as well. And certainly my focus in infant mental health and the social emotional development of infants and young children, I fully recognize the important role that the nurturing adults in those children's lives, parents, caregivers, foster parents, teachers, religious-based leaders, those are all very, very important to assure that our youngest children continue to develop and thrive during these stressful times. I have more comments on that, but I will pass it back to Julie for now.
Thank you, Dr. Alderman. I'd next like to introduce Dr. Ken Carlson. Dr. Carlson is a pediatrician at Childhood Health Associates of Salem. Dr. Carlson, is there anything that you'd like to say in this welcome session?
Well, just thanks for having me, and I look forward to the conversation and the opportunity to reach out and support patients and families. I think our challenge here is while we're having to reinvent what we do so quickly, at the same time kind of keep our eye and focus on the priorities of children's health and the development, and we're finding that certainly the need to focus on behavioral mental health has really grown, while at the same time we're having to monitor for emerging infectious conditions and shifting schedules and things that we're doing to try to keep ourselves and our families safe. So thanks for having me.
Thanks, Dr. Carlson. Next up on our panel is Dr. Lauren Herbert. Dr. Herbert is a pediatric infectious disease specialist. She works at Peace Health Medical Group in Springfield. And Dr. Herbert will also answer any Spanish language questions sent to us in Spanish. Dr. Herbert, welcome.
Hi. So I'm actually both a pediatrician and a pediatric infectious diseases specialist. So I've kind of had my eye on both the infectious diseases issues and then some of the other issues involved. Since I speak Spanish fluently, and most of my families are immigrants or children of immigrants, then I've been particularly aware of the impact on more vulnerable populations and disparity in what is happening between immigrant and minority populations and the impact of the virus on them. It's been interesting for me to watch the evolution of the care. Initially, I've been very pleased with the response of pediatricians and all of the people in Oregon, really respecting the importance of preventing transmission of infection, and been really pleased that we have had a fairly low rate. In this area, Eugene Springfield area, we've only had 4 children who have tested positive. We've had no hospitalizations. So as we've been able to feel more, as the transmission has decreased and we've been able to, we've had so few cases, we've been able to turn our attention back to the other preventive care that we need to provide as pediatricians. So it's changing all the time, and it's a challenge, but I think we're doing a good job.
Thank you, Dr. Herbert. Dr. Ben Hoffman is a pediatrician who works at Oregon Health and Science University. He is also director of the Tom Sargent Safety Center there and the Oregon Center for Children and Youth with Special Health Needs. Hello, Dr. Hoffman.
Hi, thanks for having me. It's great to be here. I'm really excited about the opportunity. I think the one thing that I would say is that there's been so much disruption and so much change and so much upheaval. I think the challenge for us is to figure out not how just to get back to normal, but how do we get back to better? Because I think if you talk to pediatricians, you talk to a lot of advocates for child health, families and communities, it was okay before, but it could be a lot better. And I think that there's an opportunity for us to help communities do that. And I'm excited about this opportunity to start.
Excellent. Thank you, Dr. Hoffman. And our 5th panelist is Dr. Lisa Reynolds. She is a pediatrician at the Children's Clinic in Portland. Hello, Dr. Reynolds.
Hi. Very nice to be here. I think I'll echo what everyone else said. I do think that this is an opportunity to rethink how we do things and to come out of this, stronger, safer, and more equitable than we were going into this. And I just want to say to patients out there, this is what we do. We take a lot of information, we distill it down to help you make the best decisions for your family. So please help us guide you through this uncertain time. I mean, we don't know everything and things are changing literally day by day, but please see us as a resource for you and your family in having to navigate this difficult time.
Thank you all. Now, what I'd like to also do now is we've gotten a lot of questions that have come in as people registered. Thank you all. And so I'm going to read some of those questions and direct them to some of our panelists to answer. There's, of course, a lot of questions about how and when to seek care during this pandemic. And Dr. Reynolds, I'm going to ask you, direct this question to you. What should parents do if their child is sick or injured during the pandemic?
Thank you. Thank you for that question. I will say that, like always, please call your pediatrician when you have questions about your child. I think a lot of practices are approaching things fairly similarly during this time. I can only speak for my practice, but I've spoken to a lot of my colleagues. We are compulsive about the fact that we will not knowingly have you mingle with someone who is symptomatic with COVID. I will tell you that it's difficult right now because I talk about the magic trick that the COVID virus has, which is that it can be transmitted even when you don't have any symptoms. Viruses are pretty smart. If we only stopped interacting with people when we were sick, the virus would not spread. The virus knows to spread itself before we get sick. So for those reasons, we are doing several things at our workplace to keep sick symptomatic people out, and to completely separate at different times of day, but also to require masking. Masking is a whole other story, but I do think that if we have masked patients, masked staff, that we will prevent someone from getting COVID-19 in the office. But first things first, call the office. We are doing quite a bit of telephone medicine like we always have. We have now added in telemedicine using Zoom rooms, and it's been incredibly rewarding. And then if we all agree that your child needs to come in to be seen by a physician in our office, which we think is much safer than an exam room or an urgent care, then we will make it the safest possible that it can be, short of having you stay at home. So call on us, please.
Thank you, Dr. Reynolds. You mentioned telemedicine. I know that's been a huge change for healthcare providers and their patients. So let's talk a little bit more about telemedicine. Dr. Carlson, I'm wondering if you can tell us a little bit more about what kinds of health issues can be covered by video or telephone, and which ones need to be in person. One question we received was, can a doctor tell how my child is breathing from a video visit?
Thanks. So yeah, our clinic, like a lot of others, had been planning to add video visits and in a nice, slow and planned rollout. And this happened, and many places turned it on and figured it out within a week and things there. So we're still working with the technology, learning how to use it best, listening to our colleagues and those that have been doing it longer. I think our learning initially is we really kind of, I think, underestimated what we can do, or what we do with our eyes. Pediatricians, they walk into a room, they're looking at how a child is acting, how they're reacting, are they climbing over the parent, or are they just kind of laying there not moving? So we still have all of those observation skills. And so when it comes to breathing, a big part of is the observation. So it is true we aren't able to listen to lungs through the video, but we can certainly look at the chest. How fast is a child breathing? Are they using extra muscles to help in their breathing? And then again, how are they reacting? How is their general appearance and things around that? So we have found that it's been really easy to jump into things that didn't generally require an exam. So this would be questions around behavior, questions around development, questions around many mental health conditions. Currently in our office, our 2 behavioral health consultants, which are trained in psychology, are exclusively doing things with video and things around that. Beyond that, our medical providers are growing what we're doing with that. It certainly can be a first step. As Dr. Reynolds said, is do they need to come to the office or not? Could we shorten the time that you're going to be in the office by starting it out on video? Some clinics are even splitting up their well visit and doing that first part of the preventive care visit, which is more kind of talking and teaching and discussing parental concerns, and then doing any other maybe vaccines or other things at another time and things. We think this is here to stay. What proportion is still to come, but definitely I serve an area that can be pretty rural as you get outside of Salem. So I think some have appreciated not having to drive into the office, and we're glad to have this new tool.
Thank you, Dr. Carlson. And I know some of the things that we've been talking about with our OPS members are that these televisits are actually quite popular with a lot of the families. I mean, you were telling me about that too, especially sometimes with the teenagers. Did you want to say anything more about that?
Yeah, I think the experience has been, I think some teenagers are more comfortable. They're certainly fine with the technology aspect, but I think when there's a safety of being at home, it seems like they feel more in control of the visit and topics, and things going forward. So it definitely has a place. It is in some ways, I think we're realizing it's a form of a virtual home visit as well. Thinking back to the country doc going out to visit people in their homes, and now kids are inviting us into their homes, and we're meeting pets and, and others in their house. So.
And we also acknowledge, of course, that Wi-Fi and technology can be a barrier for some families. So we certainly encourage patients to let their doctors know if that's not an option for them. Thanks, Dr. Carlson. Now, another question that many parents have been asking is whether it's safe to bring their child in to the pediatrician for their scheduled well child visit and for immunizations, or if it's better to wait until after the pandemic. Dr. Reynolds, Dr. Carlson, do you want to, do you have some advice about that?
I'll share with you, what I think. Obviously, we are all very concerned as pediatricians that by delaying vaccines, we're putting patients at risk for vaccine preventable diseases, including diseases that can be very dangerous or fatal to children. So I'm sure I'm speaking for everyone, we all feel very strongly that we need to stick to the vaccine schedule. I would say especially in those first 2 years of life. And so again, all practices have set up their office in a way to, as Dr. Carlson said, minimize your time in the office. We're asking that everyone is masked, that everyone have their temperature taking. We are asking that a child comes in with one parent, not the whole family, not siblings. We definitely are doing, patching in FaceTime with the other parent, especially for well visits. So I urge everyone to please keep your child, especially on the vaccine schedule. And I think you will be persuaded when you talk to your pediatrician's office that we are doing it safely.
Yes, this is Lauren Herbert. I also surveyed the pediatric practices in our community, and all of them have a separate area for well and ill children, and are doing telephone visit, and many of them are doing the telemedicine visits as well. So I think pediatric practices throughout the state are making these dramatic changes.
And I would like to add too, I think I agree vaccines are certainly top priority there. Keep in mind all the other things that we do during our preventive visits. We're talking about safety, we're talking about behavior. This is a time of how does behavior react to stress and change. A lot of times with the teen visits, practices screen for mood disorders and similar conditions. So I would say if you absolutely have any of those concerns, or for your children, then that would be an added reason to keep up with that well visit sooner rather than later.
Yeah, we've also been screening for food insecurity, and to me it just is amazing how many people have food insecurity or other financial stressors at this time. And so we're able to hook people up with resources in the community to be able to address some of those issues as well. I also feel like so many people, there's so much more anxiety at this time too, that I think for everybody. And I think it's just really helpful to at least be able to have some safe place to express that for children.
Thank you, doctors. I appreciate that message. With the kids being at home more now that they're not at school, Dr. Hoffman, I'm wondering if you can talk about what sort of injuries you might be seeing at the hospital with kids being home so much right now.
So we have a lot of worry about increased injuries. We don't really have any data yet. There's no data from either Portland or Oregon or nationally on what we're actually seeing, but I can tell you anecdotally, we're really worried about it. We do know for sure that calls to poison centers have increased significantly. There are a lot of ingestions from medication, whether it's prescription or over-the-counter medications. I think that the issue with being at home is that there are a lot of hazards and there are a lot of risks for injury, and the fact that the exposure of that kids are now trapped in that home, and that dresser, which may pose a tip over fall risk to a child, is now in that child's life 24/7 as opposed to parts of the day. We also know that kids have been taken out of their element and their routine, and so their behavior is going to be different. We know that parents and caregivers are being asked to be pulled so far out of their routine. They're now teachers, they're working from home. And so the level of supervision is going to be different. And I think that those three things together have the potential to establish a perfect storm. Things specifically I would ask people to think about. In Oregon right now, spring is falling season. We've already seen a couple of window falls in the Portland metro area. And as you know, when we have those random 80-degree days, people open up their windows. We want to make sure that people are thinking about that and limiting their windows to no more than 4 inches, or putting bars or mesh devices. Stair gates at both the top and the bottom of the stairs, because kids, again, are going to be exposed to that constantly. Water, bathtubs, buckets, little plastic wading pools in the backyard. I talked to a colleague in Texas yesterday who has been looking for a little plastic wading pool there, and because it's been warm, could not find one anywhere. And that means to me that people are using them, and water is fascinating, especially to a younger kid. I think everybody here can tell you stories about seeing kids who drown in buckets and toilets and little wading pools, notwithstanding, you know, bathtubs, which need to be emptied when you're out of the tub, and in-ground pools as well, if you have one in your home or in your complex. I think furniture tip overs are another thing that I'm very concerned about. There have been recalls on a number of dressers, including several models from IKEA, that have been responsible for the deaths of around a dozen kids. And the only recourse for those is to anchor them to the wall. And we know a lot of families live in housing where they're not allowed to do that. And that worries me a fair amount as well. And then medications, and both over the counter and prescription, need to be out of reach, ideally locked away. Cleaning supplies, especially laundry packets and dishwasher detergent, we need to be especially careful about as well. Just so many hazards and so much opportunity. We do know that suicide rates have gone up, and so especially for families who have anybody in the home who's at risk for self-harm. And I know we'll elaborate on this a little bit more, but ensuring that medication and firearms are not accessible to those folks.
Thank you, Dr. Hoffman. Those are a lot of important points. You brought up, of course, anxiety, depression, other substance use can increase the suicide rate. We also know that, you know, with guns in the home, that access is also quite dangerous for people that are having mental health challenges, as well as other accidents. I know that Dr. Reynolds has spent a lot of time doing training on gun safety. Dr. Reynolds, is there anything more you want to say about safe gun storage in the home?
Well, certainly I think, you know, every pediatrician would agree that the safest home is a home without a gun. And the second safest home is a home, if there is a gun, that the gun is locked appropriately. And by locked, that means there's a lock on the gun itself, trigger lock or cable lock, and or the gun is in a safe that is locked. And I have been alarmed at, first of all, the increase in gun sales since the stay home order. As Dr. Hoffman was saying, that the fact that kids are at home 24/7 and the chance of them playing unsupervised and getting their hands on a gun is higher. And then, of course, in a mental health crisis, if a person has access to a gun and uses a gun in a suicide attempt, first of all, there's a very good chance that they will be successful, and that person will die. And second of all, if they aren't successful, they'll be severely injured. And we know that if we can separate a person in crisis from the lethal means of a gun, we can save that life. That person, other suicide attempts aren't near as fatal, and they go on to live long, rewarding lives. So just reiterating, if there's a gun in your home, it needs to be locked and secured safely.
Thank you, Dr. Reynolds. Dr. Hoffman, is there anything else you wanted to share?
There are resources available through children's hospitals at both Randall Children's Hospital and at OHSU Dornbecker through the Tom Sargent Safety Center. And we have staff that's available to answer questions to anybody around the state. We're doing distribution of products to help families through drive-up sales on weekends. And so if people just want to take a look at the website, they can see what we have. But as I said, we're available as a resource to anybody around the state who has questions, whether it's providers or families.
Thank you. We, of course, got a number of questions about the coronavirus, the novel coronavirus, COVID-19. It would be helpful if we could talk a little bit more about what does COVID mean for kids specifically. Some of the questions are, what should I keep in mind about my kids in the community and around family members? One question was, what should I expect when my baby is born right now? And having family help coming from out of state. Dr. Herbert, do you want to start us off on just some kind of background about COVID and kids?
Yeah, I think there's been a lot of, I mean, it's hard to listen to the news and not hear news about COVID-19. It seems like that's the only thing that's on the news right now. But so I think a lot of people are probably familiar with this information, but most children, or many children, are asymptomatic. And it's hard, we're just still gaining knowledge about this virus. And part of the limitations in our knowledge is been also influenced by limitations in surveillance and testing. So some of the, like there was a series of children from Wuhan, China, of 13, over 1,000 children, and only 16% were symptomatic. And of those, then 65% had pneumonia, 20% had cold symptoms, 49% had a cough. There's been a smaller series in the United States of 291 and of kids who were sick, and 56% had a fever and 54% had a cough. So those are the most common symptoms if they have symptoms. And as I said, as the virus has changed some, and as time goes on, we'll know more. I think there's recently been in the news children who have more severe symptoms. It's called now severe respiratory illness, or multi-system inflammatory syndrome in children. And it can be very severe. It's been reported in Europe in 18 states. Kids have fever and severe illness leading to hospitalization, inflammation, and then have heart affected, or lungs, or nervous system. So, and we're learning more about that as well. It looks similar to Kawasaki disease, something that we're much more familiar with as pediatricians. And right now people have been trying to use immunoglobulin and treating that in a way that we also use for Kawasaki. As far as transmission, that was one of the questions, right? I think most people know that it's transmitted through respiratory route. So usually coughing or sneezing, that's why now recommendation is people wear masks. People also, it can be spread by droplets on contaminated surfaces as well. And I think everybody now is familiar with, distancing. There's signs everywhere about staying 6 feet apart, and then covering coughs, and then trying to avoid crowded areas. As far as a baby, newborn baby, and I know in our hospital, every person that is admitted is tested. And that includes mothers who are admitted and going into labor with having a baby. So far, we've not had any cases of mothers who've been infected, and certainly not of babies. We have, I think it's a tricky thing about knowing whether family can come and visit. It's such an important time for the entire family with the birth of a new baby. And I think that really takes, I think it's a really good idea to talk to your pediatrician about the safety of having a family member come to visit. For example, if you're if the grandmother lives in New York City and works as a nurse in the hospital, then it's probably not a good idea she could be carrying, but she doesn't have symptoms and she knows that. If the grandfather lives in a rural community where there hasn't been any COVID-19 infections and wants to come visit and is taking precautions, that that is a lower risk situation. So I think it's worth having a conversation with the pediatrician about the safety of having relatives come to visit.
Thank you, Dr. Herbert. Any other of our panelists want to share the information about how you're talking to your patients about what COVID means for kids and families, and especially I think a lot of families are wondering about kids going out into the community.
Yeah, this is Dr. Carlson. I echoed what was said. I think fortunately the number of cases of kids themselves being ill has been low. As more testing goes, we will certainly identify more, and learning from the experience in other countries of what high percentage are asymptomatic. So our responsibility really with the kids is really trying to minimize that spread and risk to other family members and other households and things around that. At the same time, we're trying to message that please go outside if you can do it, if you have the place for that, if you have a yard or a street or things, while we're certainly discouraging using the playground equipment, being at a field and running around and getting that the benefit of that is a wonderful health benefit for so many reasons. And I think we have struggled with that messaging within our office, especially non-English speaking patients in our office, of really being scared to go to the mailbox, to even walk on their own sidewalk and things outside. So I think we're having a lot of conversations around what are reasonable precautions and what does the messaging really mean for you.
I also think it's important for parents to do their own sort of risk assessment. Your child, your community, what you have and what you're worried about. And especially when we're thinking about kids who may have developmental differences or special health needs, the advice for one family and the feeling of a parent or caregiver is going to be completely altered by their experience. So that's another place where I would say communicating with your healthcare team can be beneficial, because it's really hard to make blanket statements, because if you've seen one kid, you've seen one kid.
And kind of if I could just interject here, a different focus on the protecting children from COVID-19, and Dr. Herbert talked about the news. There's the emotional aspect too, and parents and caregivers are in a position to be able to consider a child, a baby or a child, and yes, even babies can be impacted by that stress that we are all feeling, and we know that through relational health and those nurturing relationships that children have, infants and children have with nurturing adults, that is a buffer from toxic stress. So. And that is very protective, especially during those early years and such robust brain development. Even still, with that protection, a baby or a toddler or a preschooler and on up will sense the stress that we're having. And so a very important way of protecting a young child from that stress related to the environment we're living in these days is to first the caregiver to take care of yourself, and again going back to that self-compassion, because it's so vitally important now more than ever that those nurturing adults in that child's life be available, emotionally available. And to do that, it's very valuable and very important, critical for us to be taking care of ourselves. So we protect children from the in an age-appropriate way from the news. When those issues come up, we talk with them, and we explore with them their emotional experience and help them process through that. And sometimes talking with the child's pediatrician can be very valuable as well, because that stress in a very young child can manifest itself in what might be considered medical conditions. Difficulty with feeding, stooling, sleep, those basic functions that we expect from young children can be adversely impacted from the stress. And a pediatrician is well versed at being able to have the conversation with the caring adults in that child's life and explore what the possible causes and remedies might be for that.
Thank you, Dr. Alderman. That leads to our next question. We wanted to talk a little bit about what families are experiencing right now, particularly during this sheltering in place period that we've had for the last couple of months. One question that came in, Dr. Alderman, said, "It's very hard right now in our family. My husband and I are under a lot of stress. He lost his job, so we are worried about paying the bills and having enough to eat. I'm trying to keep the kids busy since they aren't at school." Can you say a little bit more about that, following up on the comments you just made about how parents can help themselves and help their kids with the stress that families are going through right now?
Yes, thank you for that question. That's such a critically important question. And again, finding ways of taking care of oneself, the adults, the parents, the caregivers, and seeking out supports. This is a time to not be shy about exploring ways to support the family, whether that be food stamps, mental health services, group supports. This is good parenting when the adult reaches out and gets the services that the family needs to thrive. And that is taking care of yourself and taking care of your child during these really stressful times. And so first taking care of yourself so that you can be available to take care of that child. And then looking at that child, recognizing that under these stressful times, under the most caring and nurturing adults in that child's life, that child is still going to experience some level of stress. And that can manifest itself as the potentially medical conditions that I mentioned. That can also manifest itself as developmental regression, losing some basic milestones that the child had previously fully mastered. And that's a temporary thing. And that's to be expected and held and considered when supporting that child through the stressful times. And doing things like that we wish and are recommended to do, something as basic as hand washing, making things playful. It doesn't have to be a task. It can be something playful and jumping right in there with the child and washing hands together and delighting in being with your child. And singing happy birthday to the kitty in the house, and it just being playful and silly with the child, and that delight is very therapeutic and stress relief for the child and for you as the caregiver as well.
Thank you, Dr. Alderman. Dr. Carlson, we had a question about teenagers, and I know that you have been one of the trainers for Oregon Pediatric Society in our adolescent health education and behavioral health trainings. So I thought I'd ask you this question. The question is asked, Oh, and I just lost the question. Sorry, one sec. There it goes. Here we go. Our son, who loves school and learning and sees it as a sanctuary, has been demonstrating many challenging behaviors. We know his meltdowns and anger are because of the stay-at-home changes, but we are having a hard time managing it while maintaining our jobs and sanity. Do you have any thoughts for these parents?
Sure. Yeah, and unfortunately, the story is a very typical story that we're hearing. It is very fascinating to check in with families and ask how things are going and how is the kid adjusting to not being in school, and some kids really miss it. Even kids that would never admitted that a few months ago, and things around that. Is it school is that. It's the social, it's a routine, it's, and there's accomplishment and things when things go well for that child in school. Other times it doesn't for other kids. Number one is absolutely would be listening and validating the feelings of that teenager. Don't blow them off. Don't say, well, everybody's under quarantine. So, which I've heard people say that. So you have no reason to, or other people have it worse than you. That doesn't help anyone, regardless of whether it's true or not. So really that first step is that unconditional love and compassion and listening. Again, whatever you can do to keep your own sanity, if that means taking breaks and trading off, and sharing your own stresses. What are you worried about? Do you find you have many of the same worries in common? And you may unearth some worries from the teen that you may be able to reassure because what you know and what's going on in your family and household and things. Of course, reach out to your pediatrician. Many pediatric offices have behavioral health staff to, again, help to facilitate some of those conversations on things around that. And I would say probably the biggest thing I've been telling my teens, and I think this goes for ourselves as well, is, we've always said, well, when I have all that free time, here's all the things I'm going to get done. I'm going to read the Iliad, I'm going to learn the guitar, I'm going to, and that just adds stress and pressure on yourself. So take all that away, celebrate the small wins. If your 10-year-old only can do 20 minutes of schoolwork a day, then they do 20 minutes of schoolwork a day. And we celebrate that. And we know that this is going to disrupt long-term learning, but it's understandable, it affects everyone. And I think if we can support that, keep relationships strong and that compassion and that we're in it together feeling, the most powerful words you can say to your kid is I hear you, I know this is hard.
Thanks, Dr. Carlson. I wonder if our panelists have anything else to share, including healthy daily routines. Is that important during this time, especially with people trying to do online schooling? Any thoughts on that?
This is Lisa Reynolds. I mean, I know for years we've talked as pediatricians about how we wish high school started at 10 a.m., and that high school kids could really stay up till midnight and sleep till 8:30 and get a good night's sleep or 9. And so I've talked about that with families, that it might be okay to shift things a little bit, but I think the sleeping from 4 a.m. to 2 in the afternoon is not a great idea. So I think keeping some routines in place, especially around sleep, and some meal times, but allowing a little wiggle room, but not to let it get away from you. That's my thought definitely on sleeping. Eating, that's a little bit tougher. I think teenagers, and I'm thinking more about teenagers who I think are the ones who try to push the envelope on bedtime. I think that's probably okay to probably leave in the teenagers' hands unless they're really bad at managing that themselves.
Thanks, Dr. Reynolds. Dr. Hoffman, I wanted to know if you could talk a little bit more. We were talking about, letting kids outside, maybe even being with other kids. I also know there's been a lot of questions about daycare, and the governor's orders the governor's has released some new child care guidance that's asking for no more than 10 kids in a room. But I wonder if you can talk a little bit about what you're seeing as far as kids playing with other kids. And I also wondered if you could talk a little bit about kids with special healthcare needs and any special things that we should know or do as parents for them.
Sure. So if I can start with the second part first, you know, as a pediatrician and a parent, I know that even on our best days, it's really hard. And you know, parents and families who live with kids with special health needs, it's that much harder. And I think that in the disruption that in the wake of COVID-19, we've seen a lot of what has been traditionally a fairly threadbare safety net ripped even more. A lot of families with kids with special health care needs rely on therapists, rely on in-home personal support workers, rely on therapies that occur at school, and parents are now forced to do all of those things on their own, or kids are going without. And access to durable medical equipment and other things. I mean, the whole system, and not even to mention behavioral health, it's just gotten that much more complex. And I think that this is a place where our role, the pediatrician's role as advocates, comes into play. I think we all are very good at advocating on the individual level for parents and families. And I think everybody needs to understand we're as frustrated by the system as everybody else. I think it's just incredibly difficult. And so this is a time where I think it's important for us as pediatricians to be communicating with families, for families to communicate us, so we know what the issues are, we know what the frustrations are, so we can start to help individually, but also work on addressing things, you know, as we learn stuff through the Oregon Pediatric Society and other networks that we have to make things better. You know, as far as the individual risks for kids with special healthcare needs, we do know that the majority, up until the advent, the advent of the multi-system inflammatory syndrome, the kids who had been most significantly affected by COVID were kids with special health needs. And so I think it is important for parents, again, to know themselves, know their child, and not take undue risk if it's not necessary. And as all the panelists have said, you know, pediatricians, our first concern is that we do no harm, and we will do everything we can to make sure that if we need to see a child, that we're setting everybody up to succeed and keep them safe. I think making sure that you have enough medication as well. We've seen some shortages in terms of some nutritional supports. We've seen some shortages in terms of things like gloves and diapers for families, especially for kids with special health needs. But I think the rest of things, yeah, it's at least acceptable. I think the question about going outside and playing with others, you know, there's only, first of all, I think, use your common sense. Yeah, if you put 2 5-year-olds on opposite sides of the street, they're not going to stay on opposite sides of the street. They're going to try and get together. And I think we need to understand that. And if we're comfortable with it, you know, doing everything we can to minimize harm. So put masks on them if that's possible, you know, set up some rules and that sort of stuff. But at some level, kids are going to be kids, and there's only so much that we can control. So I think it's about trying to be as prepared as possible and as careful as possible, limiting opportunities where things can go wrong, but also providing appropriate supervision and setting those limits and then enforcing them.
Thanks, Dr. Hoffman. Anyone else want to say anything about that? Dr. Hoffman, we also, I think we were able to put this in our Q&A, but we had someone who wanted to follow up on your comments earlier about the resources for safety assistance. We put a website link, everyone, on the Q&A, but Dr. Hoffman, can you say again what the process is if people are interested in getting that?
Yeah, so the Tom Sargent Safety Center at Dornbecker Children's Hospital, there is we can send out the website to everybody, but if you look at dornbecker.com/child safety, and I can also, the phone numbers there, as I said, we have staff that are manning the phones during work days, and we'd be excited to talk to folks.
Great, thank you. A lot of lot of family members are, of all ages, are spending a lot more time in front of screens these last couple of months. Dr. Alderman or anyone have any tips for managing screen time with young kids? Or I think we might have maybe a different standard during these last couple months than some of the advice we've shared in years past. But anything you want to say on that?
Sure. Yeah, it's always an important consideration, and I appreciate the question. We still have recommend limits on screen time. However, during these times and the importance of the use of devices for education and making social connections when being in person isn't a possibility. The benefit of that far outweigh the risks of screen time. It's when we think about screen time, the typical recommendations are based on the fact that the more that a child is engaging with the device, the less likely they are interacting with others, which is so vitally important for child development, especially social emotional development and others as well. In these times, you as a parent and caregiver can look at what is the purpose of the screen time. Is it entertainment? Is it social engagement? Is it education? And then can make a decision as to whether or not the benefits are worthy of the screen time. And in most cases during these times, if a child is engaging in their schoolwork, or if they are connecting with grandma and grandpa via the screen, the benefits are huge for the child and the family. So it's a little different standards during these times. Being thoughtful about it is probably the take home on that.
Thank you. We have some questions that have come in through our Q&A, and I wanted to read this one and share it with our panel. Actually, this is from a mental health therapist for kids who works in Southern Oregon. The question says, right now we are doing therapy with kids via Zoom, but we are considering going back to in-person therapy. This therapist is concerned about everyone's safety, as well as, the reality of doing therapy while wearing a mask. I know that probably impinges on that rapport that's so important. They're asking if any of you have any ideas for therapists as they're planning for in-person therapy to restart that.
I'd be happy to start. That is actually a very valid and very important question and a topic of conversation in the infant mental health circles that I move in. There's not an absolute answer, but just thinking through, it's first of all, the question reflects, especially when interacting with a baby or a young child, the importance of facial expressions in that social interaction and eye contact. And so I really appreciate that insight that question reflects. There are available some transparent masks so that the child can see your face and your facial expressions during these times, which might be a medium walk between having full engagement and being safe at the same time. What I would recommend using a transparent mask is that, first of all, becoming comfortable with it yourself, because any anxiety that I may have using the mask will be transferred to the child, and the child may react with fear. And then, you know, as with so many things, when we're introducing something new to a young child, consider their developmental age, which may or may not be their chronological age. And as a way of introducing it, let them try it out. Let them see what it feels like and looks like. And again, going back to that playful approach, maybe there are some analogies in their lives of characters that the mask may be reminiscent of for them, so that it becomes a familiar item and for that child, and will have all the benefits of being able to see your face as well as being protected during these times.
Thank you, Dr. Alderman. Dr. Alderman, you brought up, I mean, and this question also gets to that idea about wearing masks. And I know that Dr. Reynolds has some policies, thoughts about masking, and I assume that y'all do. I wonder if we can just kind of make the case for masks right now about why they help. Why, I know it's something that a lot of people are feeling having some questions about right now, about the efficacy or the importance or the point. What's the point of masks? Dr. Reynolds, do you want to start us off?
Yeah, I'll take a stab at this. I've been, you know, like all of us, I've been trying to keep up on the research and what we've learned. And, you know, I mentioned earlier the magic trick of the virus, that half the people who are contagious with the virus have no symptoms. And also, we originally thought that the virus was only shed through large droplets, through sneezing and coughing that could only go 6 feet. And so if we kept 6 feet apart, we couldn't catch the virus. Well, now we know that there's a little bit more of an airborne component to how this virus travels and smaller droplets. The story of the choir in somewhere in the Washington state, where 40 out of 60 choir members caught COVID while singing together while socially distancing, is very compelling. And the research suggests that if you are wearing a mask, including a homemade mask, it will really block virus-containing droplets from you. And anything that gets out of that mask will then be blocked for a recipient if they too are wearing a mask. So if 2 people are wearing a mask, the chance of them transmitting the virus is pretty small. And for these reasons, I think, like 38 states or parts of states around the country, like San Diego, Los Angeles, San Francisco, and Seattle, that Oregon, or at least Portland, although I'm calling for Oregon, should require masking. And I will just say there is the caveat. My concern for people in communities of color, or people who are disabled who can't safely wear a mask, but my concern for people in communities of color is that this is something being turned against them by law enforcement or security personnel who make it a terrible assumption that by wearing a mask you're trying to hide criminal activity. And so we need to get that community involved in this discussion. But I will tell you that about 100 physicians are going to be sending a letter to Governor Brown today asking her to require masking, especially as most of the state is opening up.
Thank you. Before we close this call, is there anything else that anyone would like to share?
Yeah, this is Dr. Carlson. There was one other question on just vaccine development and, you know, concerns about safety. And I think that we all, you know, want this to be done right. I think we you know, the vaccines that we currently use are studied in a much more rigorous way than medications are. And before we would feel comfortable recommending it, I think any of us would do our best to educate ourselves on the studies and the efficacy, and certainly on what, you know, who would initially be recommended for. You know, kids may not be the first group if they aren't the most at risk for the most severe illness, but it's really so early in that whole process. But I certainly, speaking for myself, would be reading as much as I could to have the best information to advise families on that.
Yeah, and I think that there are multiple candidates for vaccines, and I think there really is an important consideration of response at different ages to the vaccines. And I know vaccine, I mean, in order for vaccines to be developed and to be provided, they have, in order for them to go onto the market and be given to people, they have to go through very rigorous trials and approval process. And that it would include, we would not, if there was a vaccine that was approved for adults, we would not just give it to children without there being studies in children. So we would never do that, so.
Thank you. I want to thank all of our panelists today. Thank you so much for your time and expertise, and all of you who joined us today. If you would like more information about Oregon Pediatric Society, Children's Health, and our members, please follow us on Facebook or go to our website, oraap.org or OregonPediatricSociety.org. Please take good care of yourselves, and remember, in this brave new world, who are the heroes? We all are. Thank you so much.
Thank you. Thank you. Great event.